I'm Joe Fowler. I'm the Director of Commissioning at Sheffield City Council. I work closely with the clinical commissioning group across most of my role, and we're doing some really interesting work at the moment around personal budgets and people taking control of the funding and for their own support. And that's how we came into the IPC programme, the Integrated Personal Commissioning, and we're looking forward to working with NHS England on the programme and making real progress together. The initial cohort that we want to focus on supporting to have more choice and control over their funding arrangements and their care and support are people with serious mental illness, people who've typically had an episode of poor health and are now looking to recover a level of independence and well-being. That's going to be the focus of the cohort. What that'll mean for them individually is that they will be much more able to co-produce their support arrangements, to try new things, to take some risks individually and with us. We've done a lot of work in social care on that space, so we understand some of the issues we're likely to face, and we're really looking forward to helping people through that. What we've seen in social care and mental health is people taking choice and control over the services and support, and we've used recovery frameworks and recovery outcome measures to look at the difference that that's made. We've seen massive improvements in people's living skills and people's general well-being, their social contact, and we're looking again, we're confident of seeing that extending into the health world as we bring some of those resources into. We see IPC very much as being part of our overall model, supporting people in their communities to be independent, safe and well. We've got strong partnerships with the voluntary sector in Sheffield and with primary care. Have a pretty expansive social prescribing infrastructure to connect people to community assets and support. We see IPC absolutely layering on top of that and building on it. We've seen the impact on people's lives of being able to take choice and control, the confidence that gives them, the capabilities they develop, and the outcomes that they can achieve when they do that. That's what excites me about the role. It's what gets me out of bed in the morning, and that's why we apply for the work with IPC. In challenging times that we're in now, it's all too easy for organisations to focus on the big budgets and the population-based commissioning, and actually forget that there's individuals in there with their own goals, their own circumstances, their own support networks and their own way that they want to do things. And actually what IPC can give us is an opportunity to manage the risk of those people being swallowed up by the system, and to give them and empower them to make their own choices and take control and achieve the goals that they want to achieve their way. Picture this, one of your parents, an uncle and auntie, whatever, needs some care and support to live their lives and get through the day. How would you want to sort that out? Would you want to be told what they needed? Would you want that timetable to be dictated by somebody else? Or would you want to be involved in a conversation about how your mum, your dad, your auntie, your uncle achieves the outcomes that they want to achieve? What IPC gives us is the ability to move the focus, to shift control to individuals and their support networks, and that's why it's so exciting.